I would propose in the Act, we say that the federal government will enter into a 50-50 arrangement with the provinces to institute nursing care, home nursing care, Meals on Wheels, that we would share 50% of the cost of setting up community health clinics, that we'd start a program of Denticare among school children.
But in other words, we should dictate the services that we're going to pay for.
No, we dictate the ones we're going to pay for. We would say these are the programs we're prepared to share with you on a 50-50 basis. Now, there's no way by which the federal government can dictate to the provinces that they must undertake those programs. But they can say to the provinces, if you want to institute these programs, we'll pay 50% of the cost. I think what most people miss is the essential point, namely that the provinces are even more interested than the federal government is in cutting costs down, because the provincial governments are much less able to finance their half of the cost than the federal government is. So if the federal government's worried about escalating costs, just imagine what little provinces like New Brunswick and Newfoundland and Nova Scotia feel about rising health costs.
And we get caught in the middle?
You mean the public?
Yes.
Of course the public get caught in the middle, and the public who are going to get caught most severely are the ones in the poorer provinces. With the federal government copping out of some of its responsibility for Medicare, the chances are that the more affluent provinces like Ontario and Alberta and British Columbia will be able to absorb the extra cost. But in the Atlantic provinces particularly, and in the prairie provinces if there were a few bad crops, the only way that they could get by would be to begin reducing medical care services. And if you do that, what you're really saying is there are two classes of Canadians. That those Canadians who live in well-to-do provinces are going to have a high standard of health services, and the people who live in the poorer provinces are going to have a very poor standard of health services. And that means that in the years ahead, there are going to be children who are going to be less healthy, children with poor teeth, children with long staying illnesses, whose health will be impaired because they happen to have grown up in a poor province. And that surely ought not to be the kind of standard we set for Canada.